We have to address this and say, no, these issues do take place. When we talk about child sexual abuse and crimes against children, we're talking about a public health crisis. And the only way in which any other public health crisis has been resolved is by talking about it, by taking a community approach, by looking at this as a society and saying, we need to do something to make a change, to impact this. The work that we do, unfortunately, hasn't slowed down. Knowing how we can do our work better, how we can provide clearer services, how we can become more trauma-informed, how we can support survivors, how we can assist with an investigation better, how we can connect children to supportive services that can hopefully help reduce some of that trauma that they've experienced, and to ensure that not only our staff, but those professional partners that we work with have the most up-to-date, current, cutting-edge information. By talking about it, demystifying it, we can start to make a change. When we talk about recovery, we know that more than 90% of child victims of sexual abuse never disclose. And so those 1 in 10 children who do disclose, they have that courage, they find that strength, they have that network, or somebody was paying attention. We can work as children's advocacy centers to provide that early intervention in a child-friendly way, to let that child really take control back into their lives after being disempowered and starting that process of healing. Early intervention, early recognition is that starting point, because then we can take away that stigma that they can't talk about it. We can take away the mystique of these issues, and we can really bring these issues to light and move forward with trauma-informed care and treatment. So just because something has happened to them, it does not determine the outcomes that they have in their lives. When we talk about the challenges of our work and how many individuals are impacted by adverse childhood experiences and abuse, the numbers are staggering. And so as a training professional, as a community educator, we need to be mindful of that when we go out and we're talking about this difficult work, is that no matter your crowd size, no matter whether it's a small group of community members or professionals, statistically, there's a survivor in the room. It's important to support MACA because MACA supports us in a way that we can't necessarily advocate for ourselves. The children's advocacy centers across the Commonwealth are all different. We're standalone nonprofits, we're government, we're parts of district attorney's office, we're part of medical centers. And the ways in which we can do our work and advocate for our work is different. And MACA gives us a voice that sometimes we can't collect and bring together for one mission or one goal. And when we have somebody who can champion those issues that we're seeing in our centers and bring them to that statewide level, it just allows us to unify and do our work in a better way.